If your hair feels thinner than it used to, your first thought is usually genetics or stress. But there's another common driver that often gets missed: nutrient gaps that quietly push more hairs into shedding. And the tricky part is that you can have a deficiency even if you eat pretty healthy. Hair is not essential for survival, so when the body has to prioritize, it tends to protect organs first and hair last. That can show up as more strands in the shower, a widening part, or a ponytail that feels smaller. The goal here is not to blame one vitamin and call it solved. Hair growth is a system. It needs enough calories, enough protein, and enough key micronutrients to keep follicles cycling normally. In the next few minutes, you'll learn which deficiencies are most linked to shedding, what patterns to watch for, and what to ask your clinician to check. Moving to slide 2. Before nutrients, it helps to understand what shedding actually means. Each follicle cycles through growth, transition, rest, and release. Most of the time, you lose a certain number of hairs daily and replace them without noticing. Problems start when more follicles shift into the resting phase at once, or when new growth is weaker and shorter. A classic pattern is telogen effluvium, diffuse shedding that often shows up 2 to 3 months after a trigger like illness, major stress, or a big diet change. Nutrient deficiencies can act like that trigger, especially when they reduce the building blocks for keratin, or they limit oxygen delivery, thyroid function, or cell division. Another pattern is gradual thinning over years, which can overlap with genetics. The key takeaway is this: nutrients rarely cause a perfectly neat symptom. They influence the cycle. So if your shedding feels out of proportion to what you've had before, it's reasonable to consider nutrition as one piece of the puzzle. Moving to slide 3. Now let's start with the most overlooked cause of nutrient-related shedding: not eating enough overall. When calories drop too low for too long, the body reads it as scarcity. Hormones shift, stress signals rise, and hair follicles can move into a resting phase. This can happen with aggressive dieting, unintentional weight loss, appetite changes, or even clean eating that's too restrictive. Along with calories, protein matters. Hair is mostly keratin, a protein structure, and your body needs amino acids to build it. If protein intake is low, or if digestion and absorption are impaired, hair quality can change. More breakage, slower growth, and less density over time. A practical clue is timing. If shedding increased after a diet, a new eating pattern, or rapid weight loss, it's worth investigating. This doesn't mean you need extreme protein. It means consistent, adequate intake that matches your body's needs. Moving to slide 4. Iron is one of the most studied nutrients in hair shedding, especially for people who menstruate. Iron helps your body make hemoglobin, which carries oxygen. Hair follicles are metabolically active, so when iron stores are low, they may not get the support they need. What's important is that you can have low iron stores without being anemic. That's why ferritin, your stored iron marker, often matters more than a basic hemoglobin number. Low ferritin can come from heavy periods, pregnancy and postpartum depletion, low dietary iron, frequent blood donation, or absorption issues. Symptoms can include fatigue, feeling cold, brittle nails, and restless legs, though some people feel fine. The smart move is testing before supplementing, because too much iron is not harmless. If iron is low, your clinician can help you identify the cause and the safest way to rebuild stores over time. Moving to slide 5. Vitamin D is another nutrient that shows up often in hair conversations, and for a reason. Vitamin D acts more like a hormone than a simple vitamin. It influences immune signaling and cell growth, including in the skin and hair follicles. Studies have found associations between low vitamin D levels and certain hair loss conditions, although it's not always clear if low D is a cause, a contributor, or just common in the same people. Still, if you're low, correcting it may support overall follicle function. Low vitamin D risk goes up with limited sun exposure, darker skin in low sun climates, covering clothing, and certain digestive conditions. The best approach is a blood test for 25-hydroxyvitamin D, then a plan that fits your level and your medical history. Vitamin D is fat-soluble, so more is not automatically better. Moving to slide 6. Zinc is a small mineral with a big job list. It supports protein synthesis, wound healing, and normal immune function. For hair, zinc matters because follicles are constantly dividing and building structural proteins. When zinc is low, some people notice increased shedding, slower regrowth, and changes in skin or nails. Risk factors include low intake of animal proteins, long-term restrictive diets, chronic diarrhea, inflammatory bowel disease, and high alcohol intake. One complication is that zinc and copper balance each other. High-dose zinc over time can lower copper, and copper is also involved in hair pigmentation and connective tissue. So zinc is a measure twice, cut once nutrient. If you suspect it, testing and professional guidance are safer than megadoses. Food sources like meat, shellfish, dairy, beans, and nuts can help, depending on your diet pattern. Moving to slide 7, let's talk about B12 and folate, two B vitamins tied to red blood cell production and DNA synthesis. Hair follicles are among the fastest growing tissues, so anything that slows cell division can affect growth quality. B12 deficiency is more common with vegan diets without supplementation, low stomach acid, long-term use of certain medications that affect absorption, and conditions like pernicious anemia. Folate can be low with limited intake of leafy greens and legumes, or with increased needs. Symptoms of B12 deficiency can include fatigue, numbness or tingling, memory changes, and a sore tongue, but it can also be silent. The key is that B12 and folate interact with iron status and overall blood health. If you're dealing with shedding plus low energy, it's reasonable to ask for labs rather than self-diagnosing. Correcting a true deficiency supports many systems, not just hair. Moving to slide 8. Biotin is famous for hair, but the reality is more nuanced. True biotin deficiency is uncommon, and most people get enough from a normal diet. When deficiency does happen, it's often linked to specific situations like long-term raw egg white consumption, certain genetic conditions, or severe malabsorption. That said, biotin supplements are everywhere, and there's a major catch. Biotin can interfere with some lab tests, including certain thyroid and heart markers, leading to misleading results. So if you take biotin and you're getting blood work, you should tell your clinician and ask if you need to pause it before testing. If you're hoping biotin will fix thinning hair, the better question is, do you have a deficiency, or is something else driving the shedding? For many people, iron, vitamin D, protein, and thyroid issues are more relevant than biotin. Moving to slide 9. Omega-3 fatty acids don't build hair the way protein does, but they can influence the scalp environment. Omega-3s are involved in inflammation balance and skin barrier function. Some studies suggest that omega-3 and omega-6 combinations, sometimes with antioxidants, may support hair density in certain groups, though results vary and the research isn't perfect. Where this becomes practical is in dry, irritated scalp, or when overall diet is low in fatty fish, flax, chia, or walnuts. Also, extremely low-fat diets can reduce intake of fat-soluble nutrients like vitamin D and vitamin A, which indirectly affects hair and skin. The goal isn't to chase a single hair oil. It's to make sure your diet includes enough healthy fats to support hormones, skin integrity, and nutrient absorption. If you use supplements, quality and dose matter. Moving to slide 10, iodine and selenium are two trace minerals that matter because they support thyroid hormone production and conversion, and thyroid hormones strongly influence hair cycling. If thyroid function is low, people often notice diffuse thinning, dry skin, and feeling cold or tired. Here's the tricky part. Both too little and too much iodine can disrupt thyroid function. The same U-shaped risk can apply to selenium. That's why random supplementation can be a problem, especially with high-dose kelp or multiple supplements stacking. If you suspect thyroid involvement, the most useful first step is lab testing, often TSH, free T4, and sometimes additional markers depending on your situation. Nutrients still matter, but they should be corrected with context. If your thyroid is off, addressing the underlying cause is usually more important than adding a single mineral. Moving to slide 11. Vitamin A is another nutrient where balance matters more than hype. Your body needs vitamin A for skin cell turnover and sebum production, which can affect scalp health. But excessive vitamin A, especially from high-dose supplements, has been linked to hair shedding in some cases. This is important because vitamin A can hide in multivitamins, hair and skin blends, and certain acne-related products. On the flip side, deficiency is less common in many countries, but can occur with malabsorption or very limited diets. The practical takeaway is simple. Aim for adequate intake from food, and be careful with stacking supplements. If you're taking multiple products, add up the totals. If shedding started after a new supplement routine, that timing is worth noting. Hair follicles respond to internal signals, and vitamin A is one of those signals that can swing either direction, depending on dose. Moving to slide 12. A big reason nutrient issues get missed is absorption. You can eat the right foods and still come up short if your gut can't absorb them well. Low stomach acid, chronic gastritis, celiac disease, inflammatory bowel disease, and bariatric surgery can all reduce absorption of iron, B12, zinc, and fat-soluble vitamins. Even frequent use of certain medications can change absorption for some people. Another factor is chronic inflammation, which can shift how your body handles iron and other nutrients, keeping them locked away even when intake looks fine. If you have ongoing digestive symptoms, bloating, diarrhea, constipation, unexplained anemia, or persistent reflux, hair changes can be one more clue that something systemic is going on. In that situation, the most effective plan is usually medical evaluation plus targeted labs. Moving to slide 13. So what should you actually do with all of this? Start with a simple, structured approach. First, map the timeline. When did shedding start? And what changed 2 to 3 months before that? Diet, illness, stress, postpartum, new training, or supplements. Second, think in categories. Enough calories, enough protein, and then the common micronutrients like ferritin, vitamin D, B12, zinc, and thyroid markers. Third, avoid supplement shotgunning. It can mask the real issue, waste money, and sometimes create new imbalances. Instead, bring a short list of questions to your clinician and ask what labs make sense for your symptoms and risk factors. And remember, hair grows slowly. Even when the trigger is corrected, visible improvement can take months because follicles need time to cycle back into growth. Patience is part of the process, but guessing is optional. Moving to slide 14. Let's close by putting it all into one calm checklist. If your hair is thinning, nutrients may be a contributor, especially iron stores, vitamin D, zinc, and B vitamins, plus overall calories and protein. But hair shedding is multi-factor. Genetics, thyroid disease, scalp inflammation, postpartum shifts, and certain medical conditions can all overlap with nutrition. The most helpful mindset is investigate, don't panic. If you want one practical next step, it's to write down your shedding pattern and your recent changes, then ask for targeted labs rather than guessing with supplements. If you found this breakdown useful, subscribe for more evidence-informed health explanations that stay practical. And for a quick check-in, leave a comment with your answer. Have you had your ferritin tested? Yes or no? This information is not a substitute for medical advice. Health is not